It's a pleasure to be with you. The title of this session is Origins of Public Health, Part 3. There are no disclosures for this presentation. Objectives include review the response to injuries and non-infectious diseases during the Industrial Revolution, discuss advocacy, lobbying, and activism and how they impacted the response to injuries and non-infectious diseases during the Industrial Revolution, review key labor laws that emerged in Britain and the United States in response to the Industrial Revolution, review the 6 steps to accomplish big goals, review key concepts of strategic effectiveness. In part 1 of this series, we reviewed the 6 eras of public health, discussed the impact of the Industrial Revolution on the sensibility of public health, reviewed the classification of health problems, and reviewed a few reports and interviews regarding living and working conditions in England during the Industrial Revolution in the 19th century. In part 2 of this series, we continued to review the emergence of public health social justice due to industrialization in the 19th century, reviewed the first of 3 public health practice efforts emerging from the Industrial Revolution, response to infectious disease outbreaks, including discussion of the 4 public health responses to contaminated water and inadequate sewage handling, and how these responses helped control infectious diseases. We also discussed what laws, policies, rules, and regulations are, and how they relate to each other, reviewed major U.S. drinking water and wastewater treatment laws, and discussed the history of antibiotics and their impact on lifespan in the 20th century. 3 major public health practice efforts that developed since the Industrial Revolution included response to infectious disease outbreaks, response to injuries and non-infectious diseases, and the development of the field of epidemiology. We focused our initial discussions on Britain, since those responses initiated the definition and development of public health as a profession, and subsequently influenced Europe, the United States, and the rest of the world. Let's continue our discussion of public health practice responses initiated during the Industrial Revolution by discussing responses to injuries and non-infectious diseases for a few minutes. Factories of the period were grim and dangerous places to work that often led to injury, permanent disability, and chronic occupation-related diseases. Long hours, little rest, poor ventilation, exposure to dangerous equipment and chemicals, and harsh enforcement of workplace rules were the norm. Factory accidents were common. One hospital in England reported that every year it treated nearly 1,000 people for wounds and mutilations caused by machines in factories. In 1842, a German visitor noted that he had seen so many people in the streets of Manchester, England, without arms and legs, that it was like living in the midst of an army just returned from a campaign. The public demanded investigations of factory working conditions, including child labor abuses, which resulted in legislative action, labor laws, and policies to address these issues. This public pressure on politicians is an example of grassroots advocacy and activism. Let's spend a few minutes discussing the important tools of advocacy and activism. Advocacy refers to the act or process of supporting a cause or proposal, whereas activism is the action of using vigorous campaigning to bring about change. Lobbying is a specialized form of advocacy that focuses on influencing legislative policies. Advocacy can be confrontational or non-confrontational. Both types of advocacy are important, but must be used wisely, dependent on the situation at hand. In my experience, effective advocacy is often subtle, quiet, and behind the scenes. Activism is often synonymous with confrontational advocacy and is generally visible and in your face. Sometimes activism is counterproductive, undermining the ultimate accomplishment of a goal. It's always important to ask the question, will the action chosen, confrontational or non-confrontational advocacy or activism, potentially win a battle, but ultimately lose the war? It takes good leadership judgment to determine which type of advocacy will be most effective to reach the goal. British responses to the Industrial Revolution included both activism and advocacy. Let's spend a few minutes discussing key concepts of lobbying. Identifying appropriate areas of influence is a major part of a lobbying strategy. Where to focus resources and activities to obtain the goal? There are generally three arenas of influence for public health policy work: legislative bodies, administrative branches, and courts. The most effective way to influence public laws and policies is through lobbying the legislative body. The legislative body is where laws are developed that impact workplace safety, social behaviors, violations of standards, etc. The executive or administrative branch can occasionally influence policies through executive action or orders, but can't make laws, since that's a legislative function. Complex issues are usually settled in the courts. Litigation is necessary when legislative bodies have no authority or refuse to act, when federal, state, and local decisions are contradictory, and when there is reason to believe that laws have been violated. Lobbying is generally of two types: direct and grassroots. Direct lobbying is when a group directly tries to influence elected and appointed leaders to adopt the group's position. Grassroots lobbying relies on educating, mobilizing, and activating the public to persuade elected and appointed officials to support a position. Direct lobbying requires building positive relationships with officials, monitoring legislative processes, and providing expertise and information to officials. Grassroots lobbying requires activating the public and mobilizing them around advocacy issues. Both direct and grassroots lobbying are regularly used in public health advocacy efforts, as we'll see happened in Britain and the US during the 19th and 20th centuries. Let's consider the history of key child labor laws enacted in Britain from 1830 to 1891 because of public grassroots activism, advocacy, and lobbying efforts. The 1833 Factory Act was aimed at improving working conditions for children. The provisions of the law included there should be no child workers younger than 9 years of age. Employers must have age documentation of child workers. Children between the ages of 9 and 13 should work no more than 8 hours a day, and between the ages of 13 and 18, no more than 12 hours a day. Children are not to work at night. There should be 2 hours of schooling each day for children under 13 years old. 4 factory inspectors must be appointed to enforce this act throughout Britain. This slide lists additional laws passed from 1847 to 1891. In 1847, the Factory Act limited the workday to 10 hours for women and children younger than 18 years old. The Coal Mines Regulation Act of 1860 prohibited boys younger than 12 years old from working in underground mines unless they could read and write. The Chimney Sweep Act of 1875 required that all chimney sweeps be licensed and that licenses were issued only to sweeps not using climbing boys. The Factory and Workshops Act of 1878 prohibited child workers under 10 years old. The Factory Act of 1891 required better fencing of machinery, prohibited pregnant women workers within 4 weeks of delivery, and raised the age of child laborers from 10 to 11 years old. Child labor laws in the United States lagged behind those in Britain. The National Child Labor Committee was formed in 1904 as an organization dedicated to the abolition of all child labor in the United States. By publishing information on the lives and working conditions of young workers, it helped to mobilize popular support for state-level child labor laws. These laws were often paired with compulsory education laws designed to keep children in school and out of the paid labor market until a specified age, usually 12 to 16 years old. In 1906, Republican Senator Albert J. Beveridge introduced the first national child labor bill, but that bill was opposed by President Theodore Roosevelt. In 1916, under Advocacy and Activism from the National Child Labor Committee, the National Consumers League, and the emerging class of women voters, Congress passed the Keating-Owen Act, the first U.S. federal child labor law, outlawing interstate commerce involving certain goods produced by children. There was opposition from Southern Democrats and President Wilson, but due to public and political pressure, this bill was approved. However, the U.S. Supreme Court struck down the law, arguing that its implementation would not only regulate interstate commerce, but also intrastate commerce, infringing on states' rights. The most sweeping federal child labor law was the Fair Labor Standards Act of 1938 that protected youth educational opportunities, restricted youth work hours, and prohibited child labor that was detrimental to their health and safety. It took 3 decades, but by the 1930s, child labor was significantly reduced in the United States. Realize that these laws took almost a century to enact in Britain and the United States, many of which seem meager achievements or even grossly inadequate from our perspective today. Yet it demonstrates initial attempts to improve appalling working conditions during the Industrial Revolution. It's not unusual to take years and even decades to accomplish public health advocacy and activism goals. This quote from Geoffrey Chaucer seems appropriate for public health professionals. Patience is a conquering virtue. Public health leaders must be patient and persistent to obtain challenging goals that will improve the health and safety of the people they serve. So how can leaders faced with huge adaptive goals keep from being overwhelmed to the point of losing heart? It sometimes helps by breaking down huge goals into incremental steps. Public health progress is often accomplished by a sequence of steps toward a goal. Kelly Hyman suggests 6 simple steps to take to achieve a larger goal. 1. Be specific. 2. Break down big goals into smaller steps. 3. Track your progress. 4. Set a timeline. 5. Celebrate small wins during the process. 6. Rinse and repeat. The first step in achieving any goal, big or small, is to develop SMART goals. The S of SMART goals stands for specific. State clearly what needs to be attained. The M stands for measurable, which allows you to evaluate and track your progress. The A stands for achievable. Is this possible to accomplish? R stands for relevant. Does this fit the mission and vision of the organization? Does it make sense to do this? T stands for time-bound. State when the goal will be accomplished. Several of Kelly Hyman's steps to achieve goals relate to this SMART format. The first step Kelly Hyman suggests is being specific. Goals must be clearly defined, as in the SMART goal format. If not specific, you'll not know what you're aiming at or whether you've attained it. For example, instead of vaguely stating that a tobacco prevention program should increase individuals participating in the program, consider adding specific language that provides goal direction, like the tobacco prevention program will increase the number of people participating in the program by 10% by the end of the calendar year. It helps to state what you want, followed by a measurement or timeline. This helps clarify the goal's finish line and sets the stage for what it will take to get there. It's also helpful to break down large goals into smaller steps. For many people, the visualization of seeing the steps to a major goal is helpful. To do this, many individuals will start with the major goal and work backwards. Incremental steps encourage momentum to goal achievement. I like this quote. A dream written down with a date becomes a goal. A goal broken down into steps becomes a plan. A plan backed by action makes your dreams come true. Once goals are specified and broken down into a step-by-step plan, it's time to determine how progress to accomplish those steps and goals will be tracked. There are several project management tracking systems available, including Basecamp, Trello, or digital calendars in Google or Outlook that allow users to track step and goal progress. Tracking progress provides accountability and motivation to achieve goals. Success in achieving a step provides encouragement and incentive to continue to move on as the goal is now one step closer. A marathon is run one step at a time. After several hours, the finish line is finally crossed, the goal obtained. This is a good example of how many significant public health goals are achieved through patience and persistence, one step at a time. Setting a timeline is essential to efficiently progress toward accomplishing a goal. Time-bound is the T of the SMART goal acronym. Many goals aren't met due to the abandonment or departure from assigned timelines. Timelines provide motivation, help maintain focus, and counter procrastination by creating an element of urgency. Having clear timelines also helps to effectively and efficiently use resources. The path to almost every large goal will not be smooth as illustrated in this picture. There will be flat tires, overheated engines, and mechanical breakdowns along the way. But along with those challenges, there will be successes. Celebrate successes along the way, even if they're small. Don't wait for the finale. These times of celebration will lift the spirits and be an encouragement to press on to the goal. The last of Kelly Hyman's steps is rinse and repeat. This means that after you've achieved a step or goal, assess for things that went well and what didn't, and decide what can be done to improve the process. All of life is a work in progress. Wise individuals and organizations learn from their experiences and adjust appropriately. This process is often called a quality or performance improvement cycle and is a major part of strategic effectiveness. Let's spend a few minutes reviewing key concepts of strategic effectiveness. We want to be as effective as possible as we seek to achieve goals. Tim Fallon is an expert in strategic planning and identified 5 principles of high-performing groups. 1. There is no relation between the time spent in planning and implementation. In fact, if an organization spends excessive time in planning, they get stuck in the planning loop and never progress to implementation. In those situations, the whole plan becomes to plan. Strategic effectiveness is related to an organization's ability to set reasonable, not perfect, goals and consistently achieve them, which translates into formulating a good enough plan. Insisting on going from good enough to near perfect or perfect often results in the juice not worth the squeeze. It usually takes no more than a few hours of appropriately facilitated strategic planning and discussion to find a good enough plan in most organizations. 2. Once a good enough plan is identified, high performance groups moved quickly to implementation. 3. Both high and low performance groups regularly reviewed their progress, but low performance groups tended to embellish their results, also called result inflation. High performance groups were brutally honest with their evaluation data. 4. High performance groups made real-time adjustments to their strategic plans. Some things will work, others will not. The world or environment in which an organization lives is constantly changing. The major point is that organizations need to adapt and change, or their strategic effectiveness will die. 5. High performance groups focused on results, where low performance groups focused on activities. The low performance groups often said, "We are working hard, therefore we must be doing well." Working hard doesn't always translate into desired results. Strategic effectiveness is an organization's ability to set the right goals and consistently achieve them. That usually is accomplished through a common cyclical performance improvement process of 4 stages. 1. Formulate a strategic plan. This is the grand entrance to the cycle. 2. Implement the plan. Remember, a good enough plan, not a perfect plan, is what is needed. 3. Review the plan. This is the evaluation phase. 4. Readjust the plan based on results of the evaluation. Remember, high performance groups were brutally honest with the evaluation data and utilized that data to make key adjustments to their strategic plan. This cycle continues since strategic planning is not meant to be static but dynamic. It must flex and adjust to be effective. As individuals or groups work through problems, they improve and develop finesse. Kelly Hyman states that once you've found a groove, things that work, take what works and apply it to your goals going forward. In summary, advocacy, lobbying, and activism are major public health tools to influence laws and policies. Developing smart goals are essential. Patience and persistence are required to achieve big public health goals. Public health progress is often accomplished by a sequence of steps toward a goal. High-performing groups develop good enough plans, are brutally honest in analyzing performance evaluation data, and make real-time adjustments to their strategic plans.